Hey everybody, this is Dr. Monica Du, pediatrician here. I wanted to go ahead and talk about fever. This is a very common presenting complaint by many parents worldwide, and it is something that causes much anxiety and fear, even fever phobia. Many of us don't even want to hear the word at all. We become very alarmed, and that is definitely understandable because we often link fever to something that can be quite detrimental to one's well-being. However, in common, normal, usual, everyday circumstances, fever does not equate to necessarily a dangerous situation. It's just our body telling us and signaling to us that something is a little bit off balance from what we are normally used to. And basically, most of the time, a fever will come across our lives if ever we have something infectious or inflammatory, but it can also be um, a possibility in things such as malignancies and other illnesses. But most oftentimes, especially in our children, a fever just signals to us that they may just have had a viral invader. Sometimes it can be a bacterial invader, but fever is not just the only thing that we look at. We always have to look at the total picture. We have to see how the child is appearing, and I'll go into some further details about that. But with regards to the fever, I just wanted to give you a few background points about that. So when a fever occurs, our body sends off certain signals or chemical messengers, cytokines, macrophages, which are a type of white blood cell that helps us to combat any invaders that may come into our body system. And when that happens, that thermostat that normally helps to regulate our temperature will reset itself so that it can maintain a higher temperature at a safe level so that that way our body can work on getting rid of the invaders that are causing havoc in our bodies. So it's actually a natural defense mechanism that our body uses among the many other amazing things that our body does. This is actually a natural immune defense that helps us to actually kill those invaders. So fever is not a bad thing. So we don't always want to reduce temperatures all the time. Sometimes it is okay to have a fever and not have to worry about it. But if the fever is getting to a persistent elevated point, as I will discuss in a few minutes, then there are things that we want to go ahead and do. Now, of course, we can measure our temperature using different methods. Most often, we're going to use the oral thermometer. The most accurate, however, is a rectal temperature, especially so for infants, newborns. Those that are 2 months and under, you definitely want to make sure that you have a rectal thermometer available so that you can get the most accurate measurement possible. But in any really age group, the most effective temperature method is the rectal temperature. Now, in general, a fever is anything 100.4 degrees Fahrenheit and above for newborns and infants. And then there are even more specific scales that tell us for 3 months and older, persistent temperature elevations 100.4 and above 101 is what we would classify as fever for the older infants and children. But just to let you know in general, just a quick memory tool if you wanted to remember what is a fever for infants, anything 100.4 and above, and then for older and above, you can just kind of think of 101, 102. That would be kind of your baseline to help you remember what an actual fever elevation is. Oftentimes, another thing that we want to remember, of course, is what are we going to do when our child has a fever? So for me, I find it very useful to try and do the things that you can do without grabbing the medications. And that means you can, of course, dress them lightly. You know, the more clothes they have on is the more their temperature is going to become elevated. So dress them lightly. If it's a infant, you can just put them in even just a light t-shirt and their diapers, or even just a diaper alone. Make sure that the temperature in your house is balanced, and just keep them cool in that manner. And then even for infants, older children, toddlers, you can go ahead and dress them lightly too, and you can also give them a tepid bath. So that means not too hot, not too cold, just kind of nice baseline tepid bath that will help to cool them as well. I do that many, many, many times for my own children, and I find that it is a great help for me before I reach that medicine cabinet. And then another thing you can do is also take a cool compress or a cool washcloth, not too cold, but just cool, to touch, and put it on their forehead, put it on the back of their neck, and go ahead and put it on the bottom of their feet. That's also another way that can kind of help to coax that temperature down before you reach the medications. Now, I'm sure you all know of the common medicines that we use, and of course, that's going to be something with acetaminophen, which is also, more so as Tylenol, and then there's the ibuprofen, and then you also know of the most common ones being ibuprofen, um, Motrin, Advil. So any of those are what we usually grab whenever we want to go ahead and bring our temperature down quickly. But remember, anytime you grab a medication, make sure that you are dosing appropriately. Now, that means that you want to dose weight based, not just based on the age, because sometimes children may be a little smaller for their age or a little bit larger, and of course, that is going to have an effect on how the medication will work. In pediatrics, we do things very much so in a weight-based fashion to be safest and most effective. So make sure that you look at the medication instructions on the product and make sure that you follow the weight-based dosing. And then another key point to take note of is that in infants that are not 2 months old, and above, you are not to give any ibuprofen, Motrin, or Advil products to them. They are not able as yet to process and metabolize that product. So that means that if ever they did have a fever, the medication that would need to be used is acetaminophen or Tylenol product. However, remember, mommies, if your infant is 2 months and below, and they have a fever, you need to bring them to the physician. It doesn't matter, how they're looking, even if they're looking great, smiling at you, feeding appropriately, it can be dangerous. Sometimes babies don't necessarily present ill until it's too late. So if ever you notice that they have a temperature of 100.4 and above, bring them to your doctor. Don't give them Tylenol quite yet. Bring them in, and then we can appropriately dose them based on their weight, and we can evaluate them and make sure that they are safe to return home with you, or if we need to do any further evaluations and studies, then they can go ahead and get it done while they're in our office, or if they have to be referred for another service, then we can do so. But we need to take a look at them, so don't leave them at home with you and try to care for fevers in newborns and those 2 months and younger, because it can be dangerous. So, please be aware of that. And then remember, as I said, no Motrin or ibuprofen, Advil products for those that are 2 months or older. They are not meant for that age group, but it can be given for infants that are 2 months and up. So that's a good note to be aware of. So I wanted to definitely go ahead in on red flag signs for anybody. If a temperature is persistently 102 and above for somebody 3 months to 3 years old, you should also bring them in. Also look at any other associated signs and symptoms, and try to keep a track on them, so that when the pediatrician asks you if there's anything else that you notice, then you have a nice database already in your mind. Yeah, it looks like maybe he had a sniffle, or maybe he had some loose stools, or he was vomiting, other signs of associated symptoms. Keep those in mind, if any at all. If none at all, then that's fine, but definitely good to keep in mind. So if anybody 3 months to 3 years old having a temperature of 102 and above persistently, let them get seen by their physician, please. And then, of course, if anybody at all in any age group is having a fever of 104 and above, that can be dangerous for anybody. So definitely bring them in as soon as you can. Let them be evaluated. Don't just try to treat a fever at home when it's that high. It can signal something that is quite dangerous to their health and well-being. So let your physician, your pediatrician take a look at them if ever you have a situation like that. Of course, further red flag signs, they are just not taking in any fluids, not eating well at all. They are just looking lethargic is a key word. That means just not at their baseline mental status, beyond fatigue, not wanting to wake up, very fussy, cranky, babies that are inconsolable, crying all the time, nothing you can do will comfort them. You have to bring them in to be seen, please. In children, um, if we are not careful, they can decline rapidly. So make sure if anybody has a fever of 104 and above, no matter if they're a newborn, an infant, toddler, older child, young adult, bring them in to be seen by their pediatrician, because we can evaluate them and make sure that we make certain that there's nothing that can harm them, in the long term. So be aware of those things as well. And then certain special conditions to be aware of. If anyone has sickle cell disease, these patients are very, very much at risk for serious bacterial infections, sepsis, um, very severe conditions that can lead to even death. So if anybody with sickle cell has a fever persistently and they're not looking right, let someone evaluate them. And then, of course, for those that have chronic medical conditions, respiratory illnesses, premature infants, just anyone with heart disease, congenital heart disease, if they have a persistent fever, let the physician take a look at them to make sure that everything is all right. It's better, safe than sorry. It's easier to take the trip to the physician's office than have to worry about other, life-threatening issues that can occur if we are not following up on someone with conditions such as these that have a fever. So please ensure that you let someone take a look. And then lastly, to wrap up, if anybody of any age has a fever with an associated unexplainable rash, don't stay home with that. Make sure you come in and let them get seen. And of course, if anyone is, beyond their baseline mental status in association with any of the above things that I talked about, you should go ahead on to urgent care center or emergency room. Don't even stop by the pediatrician's outpatient center, because we will have to refer you anyway for further care. We want someone that needs urgent care to get the care that they need ASAP, rapidly. So don't even bother to wait if they have a change in their baseline mental status and they are not, that child that you are usually aware of. Definitely take them in to be seen urgently. All right, I hope that the fever discussion was helpful for you. Those are just kind of a few tips to consider and keep in mind. Fever can be a very, very scary experience for all of us. No matter whether we're first-time moms or even seasoned ones, it can be a scary, scary experience. So just keep these tips in mind, and definitely view some of the information that I will be posting with regards to the fever, inflammatory cascade, and chemical messengers that help us to fight invaders. So that way you get even a closer insight on what I was discussing with you today. And then if you have any questions, definitely post and please do share with your friends. This is a very common and important topic, and many people are not aware of the management. And the more informed we are, the less anxious we are, and the better able we are gonna do the things that we have to do for our children. All right, see you all later.